And on this appliance, we actually create the perfect bite. So your mind, in essence, bites onto this thing. Everything feels balanced. Everything feels even. And you've basically fooled your mind into saying, okay, I got the perfect bite. There's no reason for me to clench my teeth. And so you don't do it in your sleep. And now your muscles are no longer tense. And you wake up headache-free.
Interesting.
Another symptom that a lot of people go to physicians for would be the neck pain. And along with the headaches, the neck pain, there's certain muscles that are actually in the neck that are associated with clenching and chewing. And so if you're doing this all night long, you wake up with the headaches, but you also can wake up easily with neck pain, shoulder pain, upper arm pain. And another area is numbness. So if you have numbness that's radiating into the back of the hands or the fingertips, or a person we just treated last month, all around their mouth and their lips, they were numb. Numbness could be the muscles, again, contracting and being overused and inflamed and pinching on the nerves, and so you can get this numbness. So there's a lot of symptoms where people are going to other physicians and getting treated and being put on a lot of medications for their headaches, for their neck pain, or numbness, or going through CT scans when it could be something as simple as clenching and grinding the teeth. So if you were to look at your own teeth, or if there's any physicians here and they look at a patient's teeth, some of the signs and symptoms here, you can see this area right here. This groove fits perfectly into that point right there. So you can tell if they bite down and slide to the side, that will fit right there. This will fit right into this area. Everybody see that?
Mm-hmm. Yeah.
And then here's an example of an abfraction lesion over here. So we can see this flat area right here on their tooth. They're worn the tooth down here, and they're putting so much pressure on it that it flexes and it starts to chip away right there. Here's another example. These teeth are very, very short. You can see the wear. The tooth is actually wider than it is longer. So they've put so much force on their teeth and been rubbing them together for so long that the tooth is now half of its regular length. Another perfect example. There's no way you can see that that point right there doesn't fit exactly into that spot when they're chewing. And we're talking about the hardest surface in the body, which is enamel. So as we're putting, on average, 160 pounds of force in here and rubbing back and forth, we're just wearing the teeth down. And you do it, you don't do it all night long. You'll do it in spurts. And you'll do it during times when you're more stressed out. So if, by chance, you didn't sleep very well the night before, the following night, you don't actually get as restful sleep as you think you do, and you'll really clench your teeth bad that night. Also, drinking, alcohol, just irregular sleep patterns and stuff will create this problem. And if you have if you're a type A personality, have a lot of stress, of course that's the other aspect of it that is a little more difficult to control. It's not only always stress-related or something. Dentists can actually cause part of the problems themselves. If you look here, these are crowns. When this patient came to see me from a previous dentist, they're older type crowns with a metal base, which is this black line. And some of the older porcelains were very abrasive, like sandpaper. So if you don't catch this early, this person's bottom teeth here, you can see have been completely worn down by rubbing against this abrasive porcelain. And these teeth are half their normal length, and these little dots you see here, 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 and here is actually where the nerve in the tooth used to sit. So, you know, this person could end up going to root canals and having all sorts of problems.
Is it painful at this point?
It is not. It's a slower process, and so the nerve actually, there's enamel on the outer surface, this white area, and then this orange area is something called dentin. And the nerve, when it sits there, it was throwing out more dentin as it realized it was basically being attacked, the tooth was being traumatized, trying to throw up an extra wall of defense. So the nerve used to sit, say, up here. The nerve is receded all the way down here. So it's trying to avoid further trauma. So when it comes to talking about TMJ, 90% of it is muscular related. So we really talk about that aspect of it. There's two different philosophies that are out there. One is centric relation and a Pankey philosophy, basically based out of Florida. Another is, and it's been around for a very long time. It's kind of the gold standard from the beginning. Neuromuscular dentistry is something that's come into play over the last 40 years and is being basically taught out at LVI and being taught by a lot of the big lecturers in dentistry and stuff now. I've had training in both, and I say that I believe that both of them work with certain cases. So I don't think that either one is completely right. I think they both have their ideas. Centric relation is basically based on the idea of where the bone sits in the joint, and then the teeth have to be balanced from there. Neuromuscular dentistry involves using TENS units and talks about the muscles and where the muscles want the bite to be. The reality is, since I've had training in both, I've been able to treat both ways, and I've had some unbelievable results with patients. Some examples of that. One day we had a young girl sitting in our room, and she was in there for a cosmetic consult. I could tell by looking at her teeth and her jawline and everything else that she clenched her teeth. And so I started asking questions, and I looked at her mom and her sister who happened to be sitting in the room with us, and I could just look at their teeth and could tell instantly that they all were grinding their teeth. And I said, just like you're grinding your teeth, you may have headaches, you may have neck pain, and all of a sudden their eyes just got really big. And I knew I'd hit a chord, and I said, okay, what's going on? And the sister, who wasn't actually there for anything, had been to 5 neurologists here in town with her debilitating headaches. They could not figure out what was going on. They had no more ideas, so they were sending her to a special, I believe, migraine clinic. I believe it was in Detroit. It was Detroit or Chicago. I don't remember now. So I asked her to sit in the chair for just a minute. I looked at her teeth, and I said, if you don't mind, before you go out of town, if I could just make this appliance for you and see if you know, how it works. We made the appliance, put it in her mouth, and to make a long story short, she never went on this trip to Detroit. We got rid of all her headaches.
Wow.
And
Wow.
so they were, of course, they were doing CT scans. They're looking for vascular problems or you know, tumors or anything else that are going on possibly in the brain. And it was all related to clenching and grinding. I've had another patient, we were talking about sinus infections. I had another patient, we ended up rebuilding her bite through crowns and veneers and this nature. And before we started, she told me that she gets 3 to 4 serious sinus infections every year. And I said, we'll be really interested to see when we're done here if your sinus infections ever go away. And I told her if they did, she was going to owe me a gift. And sure enough, when we finished, it's been about 5 years now since we finished her case. She has not had one sinus infection since then.
Wow. Did she give you the gift?
No, you know, she ended up saying that I was supposed to give her the gift. And I ended up doing it. I got her some flowers and some movie passes or something like that and gave it to her.
That's a rip-off.
Yeah. Some other cases that I think about, I've had patients that have had all sorts of neck surgeries and problems. We ended up rebuilding their bites, and all their neck pains went away. They've gone through previous surgeries. I've had that have had every single tooth in their mouth root canal thinking it was tooth pain. And when we actually look at the bite, we're able to cure these things. As I mentioned earlier, we had a case just about 2 months ago that came in, and she was having numbness in her hands and all the way around her mouth, lips, and just all in general around it. And when we treated her from a neuromuscular standpoint, when we put her in the appliance to correct her bite, her numbness went away instantly.
What do you mean instantly?
She called me the next day, and it was all gone. So,
wow.
And we continue to get these results. I'm always amazed what we've been able to accomplish. You know, I always go in saying, I hope we can help with these headaches. I hope we can help with the neck pain. I hope we can help with this numbness. And the further I go, the further I keep going down. Neuromuscular dentists and LVI, this Las Vegas Institute, will tell you they've even treated lower back pain, pain in the feet, legs, and I just haven't gone that far yet. I've gone down to the hands and the numbness there, and I continue to say, okay, what other symptoms did you have before? Are they better? And I keep getting astounded. and amazed at the results we're getting.
Did you say that some feet problems can be related to things going on in your mouth?
Well, I know at Las Vegas Institute, where they teach this and where I've taken a lot of courses out there, they do. They say they've been able to treat and numbness and everything else there. I have, from my own personal practice and my patients, I have not gone that far yet. So I'm happy if I can treat the headaches and the neck pain and prevent the medications that they're on. We see so many patients that just have debilitating headaches and could be on 3, 4, 5 different medications, and we give them this appliance, and next thing you know, they don't need those medications anymore. And I think from all of our standpoints, that's our goal. We want us to be as healthy as we can and to get off all the medications that we don't need.
Mm-hmm.
And I would say it's truly a problem